Imagine taking a pill that sits in the medicine cabinet of almost every American household right now, something millions of seniors reach for every single day, and discovering it raises your risk of a heart attack within the first week of use. Not after years, not after months, 7 days. And here is what makes this even more alarming. It sits on pharmacy shelves without a warning that most people actually notice, and most doctors still prescribe it without a conversation about what it does to an aging cardiovascular system. I'm Dr. Sarah Mitchell, and this channel exists to bring you honest, evidence-based information about the medications and health decisions that matter most to people over 60. If you're in that age group, or if you're helping a parent or spouse navigate their health, I want this to be the resource you trust. Hit that subscribe button so you don't miss what we cover next, because today is just the beginning of a conversation that could genuinely protect your heart. Now let me give you the straight answer, because you came here for information and you're going to get it. The pill researchers and cardiologists are increasingly sounding the alarm about ibuprofen and its close relatives naproxen and diclofenac. These are called NSAIDs, short for non-steroidal anti-inflammatory drugs. You know ibuprofen as Advil or Motrin. Naproxen is sold as Aleve. Diclofenac is Voltaren. These are among the most purchased medications in the world, and seniors use them constantly for arthritis pain, backaches, knee inflammation, headaches, and general soreness that comes with aging. The problem is that starting around age 60, something changes in how your body processes these drugs, and what happens inside your cardiovascular system during that process is something most people have never been told. Here's how it works. NSAIDs block enzymes called COX-1 and COX-2. When those enzymes are inhibited, inflammation decreases and pain eases up. In a young, healthy body, that is mostly a good trade. But those same enzymes also help produce compounds that keep blood vessels relaxed and prevent clotting from happening too readily. When NSAIDs suppress those enzymes, they disturb a delicate chemical balance. Vessels become more prone to narrowing, blood clots more easily, and the heart is suddenly working under greater strain than it was before. Have you taken ibuprofen for several days in a row when your joints were flaring up? Comment below. I genuinely want to understand how common this is among the people watching today, because the numbers I'm about to share may change how you feel about that habit. In 2016, The Lancet, one of the most respected medical journals in the world, published a landmark meta-analysis pooling data from 280 clinical trials involving over 124,000 patients. What they found was deeply concerning. People taking standard doses of ibuprofen showed a 48% higher risk of heart attack compared to those taking no NSAIDs at all. Diclofenac was actually the worst in the analysis, linked to a 50% increase in serious cardiovascular events. Naproxen appeared somewhat less harmful, but not harmless. And crucially, the risk appeared within the first week of use. The researchers specifically noted the danger was greatest in people who already carried cardiovascular risk factors, which, by age 60, describes the vast majority of us. That same year, the FDA updated its black box warning, the most serious label they place on any drug, stating that NSAIDs can cause heart attack or stroke, and that risk can appear as early as the first weeks of use. This applies to both prescription strength and the doses you buy off the shelf. And yet surveys consistently show fewer than 1 in 3 seniors are aware of that warning. The label exists. Almost nobody reads it. Let me tell you about Margaret, a 71-year-old woman who came to our practice after her cardiologist referred her following a mild heart attack. Margaret had osteoarthritis in both knees. For 2 years, she had been taking 600 milligrams of ibuprofen twice daily. Her previous physician knew about the arthritis. Nobody had connected the dots to her heart. Looking back at her records, her blood pressure had been climbing for 18 months. She had developed swelling in her ankles that she had written off as normal aging. Those were warning signs, and they were missed, which brings me to the second mechanism, one that doesn't get discussed as often as blood clots, but is equally serious. NSAIDs cause your kidneys to retain sodium and water. In a younger person, this is temporary and minor. But kidney function naturally declines with age, and by 60, many people are already operating at reduced renal capacity without knowing it. That fluid retention increases blood volume, raises blood pressure, and forces the heart to work significantly harder. Over time, that added demand can push someone from stable heart function into outright heart failure. A 2017 study published in the British Medical Journal analyzed over 9 million patients and found that current NSAID use was associated with a 19% increased risk of hospitalization for heart failure. At higher doses, the risk climbed substantially, and the danger window opened within the first 30 days of taking the medication. This finding has been replicated across multiple countries and multiple research teams. The cardiovascular risk of NSAIDs in older adults is one of the most consistent findings in geriatric pharmacology, and it deserves to be taken seriously. Here's what most doctors won't say out loud. NSAIDs are still widely prescribed to seniors not because physicians are unaware of the risk, but because for some patients, the pain relief benefit is considered worth the trade-off. That calculation may be valid in some cases, but it should happen openly, with you fully informed. Too often, it doesn't. So what do you do if you've been relying on these medications? Stay with me, because the alternatives are not just suffer through it. There are real options that manage pain effectively without the same cardiovascular burden. Frank was a 68-year-old retired teacher who had been using naproxen every day for lower back pain for nearly 3 years. His blood pressure had risen steadily since he started, and his doctor was on the verge of adding a second blood pressure medication to his regimen. We removed the naproxen, transitioned him to the protocol I'm about to describe, and within 6 weeks his blood pressure dropped 12 points without any new prescriptions. His pain remained manageable. His heart had less to fight against. Comment below. Same situation if blood pressure changes and daily NSAID use have both been part of your life, or never connected it, if this is the first time you've considered that link. I read every comment. Here is exactly what you should do. First, if you are on prescription-strength NSAIDs or have been taking high doses daily, do not stop abruptly without speaking to your doctor, especially if you have a heart condition or kidney issues. A supervised taper matters. For mild to moderate musculoskeletal pain, acetaminophen, that's Tylenol, at 500 to 1,000 milligrams taken no more than 3 times daily is significantly safer for the heart and kidneys in most people. If you drink alcohol regularly, discuss the liver considerations with your doctor first. For joint-specific pain, topical diclofenac gel, Voltaren arthritis pain gel, available without a prescription, delivers anti-inflammatory relief directly to the joint with a fraction of the systemic absorption of an oral pill. Research published in the Annals of Internal Medicine confirmed that topical NSAIDs provide comparable relief to oral versions for localized arthritis, with far less cardiovascular exposure. Apply it to the affected joint twice daily, no more. Omega-3 fatty acids at 2 to 3 grams daily, specifically targeting EPA and DHA combined, have demonstrated measurable reductions in joint inflammation across multiple trials. Look for at least 1 gram of EPA plus DHA per serving. Nordic Naturals, Carlson, and Kirkland all carry third-party tested products. Take it with your largest meal to minimize any digestive effects. For anyone with arthritis-driven pain, ask for a physical therapy referral. A 2018 trial in the Annals of Internal Medicine found physical therapy was as effective as surgery for knee osteoarthritis, which means it is genuinely competitive with daily ibuprofen without touching your heart. Give any new regimen 8 to 12 weeks before judging effectiveness. Conditions that developed over years will not resolve in 2 weeks. And please, before changing anything you're currently taking, especially if you use blood thinners, blood pressure medications, or have any history of heart disease, review this with your physician or pharmacist first. The goal is safer pain management, not trading one risk for another. The bottom line is this. If you are over 60 and you regularly reach for ibuprofen, naproxen, or diclofenac, your heart is carrying a risk that the evidence has documented clearly, consistently, and for years. The FDA updated its most serious warning category because of it. You deserve to know, and now you do. Comment switching if you're going to bring this up with your doctor, still researching if you want to gather more before deciding, or Already knew if this was already on your radar. Every response helps me understand what this community needs next. If this gave you something valuable today, please subscribe so you're here for what's coming. Next week, we're covering a common blood pressure medication that is quietly being reconsidered in clinical guidelines. Not because it stopped working, but because of what long-term use does to kidney function in people over 65. That one is worth your time. I'm Dr. Sarah Mitchell. Your heart has carried you this far. Let's make sure it carries you much further.